So we're here to speak about the osteopathic treatment that was actually provided during the Spanish flu epidemic of 1918 to 1919. For a very long time, osteopathic practitioners have spoken quite a bit about how successful osteopathic practitioners claimed to be at treating and curing, or not absolutely curing, but effectively treating the Spanish flu and not having many deaths. Not too long ago, Jason Haxton from the Museum of Osteopathic History put out a file, or a zip file, and I don't know that I'll be able to link to it appropriately, but if you search around a little bit, you will find it. It's essentially all of the resources that Jason Haxton has compiled about reports of treating the Spanish flu. Now, what I want to talk about primarily is what was reported as the actual treatment and what was consistent, not what was inconsistent so much, but what was consistent between the reports. Now, the vast majority of the reports suggest that the treatment was based on providing enemas, providing some change in diet or some standardized diet within the given location that the report was generated in. And the general thing about the diet that was spoken about, they weren't consistent location to location, but the general consistent thing was that they were fairly bland. And then there were minimal reports about the actual hands-on treatment. The vast majority of the treatment, regardless of location, regardless of reporting individual or reporting group, that was written about with respect to the Spanish flu and osteopathic treatment was enemas, changes in diet, and also hot baths initially, and keeping people warm, trying to break a sweat. There was mention of using alcohol rubs multiple times a day, and the idea of the alcohol rub is essentially somebody would start to sweat. Right, so you're trying to break the fever and you're trying to clear the bowels. Those were the very consistent things. Then provide a very bland diet. As far as hands-on treatment was concerned, there is no consistency with reporting. Generally, what you'll see is people speaking about relaxing intervertebral musculature, so relaxing things in the erector spinae region or erector spinae region, depending on how you want to say it. You will see some mention in those files of speaking about cervical lymphatics. You will see some general protocol put forth, but nothing absolutely consistent. It was essentially treat what you find in that patient if you're using hands-on treatment. What I want to make a point of is to say it is irresponsible of the osteopathic profession to say that hands-on treatment is the thing that was effective with respect to the Spanish flu. First of all, we don't know that all reported cases were actually flu. If you read the articles that are in this file, that are in this kind of compilation of resources that Mr. Haxton has put together, you will note that some people say we didn't take anybody in unless they had a physician accurately diagnose pneumonia or influenza. You will see them say we had people coming in for a rhinitis, right? So they were sent from an infirmary to the flu hospital or the influenza hospital with something as simple as a rhinitis, so essentially a stuffy nose and some anxiety, right? So they didn't actually have the flu, or it doesn't seem like they have the flu. They were just sent over anyways because they had a stuffy nose and they were anxious. They were freaking out. We have at least one report within the case reports that are in some of these documents saying, I believe it was 82 clearly defined cases of Spanish flu or influenza and then they said that they had 82 cases, they kept good records on 82 cases, and then there was an additional 20 some odd cases that they didn't keep good records on. What this shows us is reporting problems. This shows us that the claim success, we have admission that within that claim success there was poor record keeping, or not necessarily poor record keeping, but not complete record keeping. So the numbers that are claimed cannot possibly be as accurate as we want them to be. So we know we have reporting problems. We know that when we speak about it today, what happened with the Spanish flu and osteopathic physicians was not so much a consistent hands-on approach. It was an approach with hygiene, sweating, and enemas, and changes of diet, right? This is a very irresponsible thing to speak about as a profession if we want to give an understanding of what happened. We know for a fact that we can't trust the numbers. We know now, if we read this, or if you read this as an individual, and I suggest you do if you can find the documents, that the actual treatment was not centered around hands-on work. It was centered around enemas, making the people sweat, keeping them clean, and changing their diet on some level. Hands-on treatment was provided, but was not the central, consistent feature of what osteopathic physicians did with their patients in this case. So I want to put this video out because I would like to suggest that all of you read this if you can find it, read these documents if you can find them, identify these consistencies. You don't have to agree with me. You don't have to think that what I'm saying is correct. This is what I've read. This is what I'm able to comprehend as the consistent features. And you will likely see that I'm at least on the right track, that the consistent features of osteopathic treatment during the Spanish Flu Epidemic of 1918 to 1919 were enemas. Not everybody said that they should or did use enemas, but the vast majority of people reported using enemas at varying frequencies. They reported changing the diet, not a consistent diet, location to location. They reported trying to make people sweat to break the fever that was present. And then they did report hands-on treatment, but there was nothing consistent. The central features seem to be enemas, making the person sweat, and changing their diet. So hopefully this sheds light on some of this, the claims that are made by us, to us in the osteopathic profession, so that we may all understand it a little bit better.